It comes as the NHS tries to change the way it cares for patients, using fewer hospital beds and more community care. And we'll be reporting on how those plans are causing protests in Dorset. First though, let's go live to the Royal Hampshire County Hospital in Winchester and our health correspondent David Fenton, who's there.
Thank you, Sally. Well, today, yesterday, all of last week, they were cancelling operations here and also at Basingstoke Hospital. There's going to be a 2-week stoppage of almost all orthopaedic procedures and operations here to allow the hospitals to treat more emergency patients. They're using surgical beds for those patients, and of course that means that some operations, many operations, are having to be postponed. They're not the only hospitals doing this. I mean, if we look around the south in the last few weeks, 3 operations cancelled in Poole, 10 in Southampton, 11 in Bournemouth, other hospitals the same. The issue, the problem, Sally, is always the same. There doesn't seem to be enough beds going around, and yet the odd thing is the NHS is looking to reduce the number of hospital beds over the next few years, and that's causing a lot of concerns among local groups, as Steve Humphrey now reports from Dorset.
Sign here to save our beds at Shaftesbury Westminster Memorial.
It's a campaign that's quickly gained momentum. People here in Shaftesbury in North Dorset are fighting to save 15 beds at the town's Westminster Memorial Hospital. It's an issue that's got the whole town talking.
I think it's awful. I really do.
So you want to keep it?
Of course. Absolutely.
This little hospital is very good. It must keep going at any cost.
We do need a little hospital around here. Shaftesbury covers a wide area.
Along with many other parts of the NHS, Dorset's Clinical Commissioning Group is proposing changes to everything from the county's big 3 acute hospitals to local cottage hospitals. The proposal is to keep beds at the community hospitals in Blandford and Sherborne, but to close all 15 beds here at the hospital in Shaftesbury. But a range of medical services would still be provided in the town.
I think they really should think again and really take on board the value of community hospitals to the communities. This is a community.
The Clinical Commissioning Group argues changes have got to be made because of a rising population, increasing demand and growing financial pressures.
Change is always very difficult, especially in a local community, and I absolutely understand people's fears. I can only try and reassure them that we are trying to do the best for the widest population in North Dorset. It's not so much about cutting beds, it's about providing that care in a different manner and keeping people at home.
In their campaign HQ in the High Street, these people are hoping for an NHS rethink. So far, around 1,500 people have filled in the consultation document. Final decisions will be made later this year. Steve Humphrey, BBC South Today, Shaftesbury.
Well, David, I mean, you've covered the story of winter pressure and, of course, the cutting of operations for many years. Just put today's news in context for us.
Well, Sally, the hospital trust here says that it's seen unprecedented pressures on its emergency services over the last few weeks, and of course they're not alone in that. We hear it all the time, don't we? We know A&Es are busy places, we get that, but this does sort of feel like something else, and the problem is not really the A&E in many ways, it's the lack of beds outside of the A&E for patients to go to. Let me just give you one fact on that point, Sally. Tonight at this hospital and in Basingstoke there are 80 patients, 80, who are medically fit to leave but are still in beds because they have nowhere to go, no social care package. It's not their fault. The hard fact though is if they were able to be cared for elsewhere, these operations probably wouldn't be cancelled.
So how is reducing the number of beds going to help all this?
Big question, Sally. That is the plan that the NHS is sort of tackling and dealing with at the moment. It will only work if 2 things happen. One, if they prevent patients going into hospital who don't need to be there in the first place. And 2, if they find a way of caring for people safely at home, in the community, in these GP community hubs. There's a lot of work being done on that at the moment, a lot of good ideas. We'll have to see if it happens as they hope it will.
David, thanks very much.